Welcome to the program. Melburnians have been queuing up for vaccination against the backdrop of the state's contact tracers containing their latest COVID cases. There were 11 of them today, all linked and most already in quarantine. While vaccination's gathering pace, some of the most vulnerable people in the community, including aged care workers and people with a disability, are still waiting. Nadia Daly reports.
As Melbourne enters another week of lockdown, the demand for vaccines is growing. But while members of the public are lining up for a jab, many of those in high-risk categories are yet to receive their first dose.
It's stressful. It is stressful. I would not like to be responsible to transmit anything to my resident.
Honorine Dowry is a nurse at an aged care centre on Victoria's Bellarine Peninsula. She's still waiting to get vaccinated because she was away on leave when doses were administered to staff at her workplace.
It's extremely hard. There is walk-in appointments available down in Geelong. I live in Colac, that's an hour trip away.
The federal government originally planned for aged care residents and staff to be fully immunised by the end of April. Honorine says her employer is now trying to help her get the Pfizer jab. But in the meantime, she's had to stop working her second job at another care facility.
If we're in lockdown, I don't go to both places. And of course, yes, that does affect my income, but I just have to wear it.
The problem is partly supply, according to infectious disease physician Peter Collignon. But logistics have also been far from ideal, and he says the vaccination of high-risk groups must now be the most urgent priority.
We need to work out better how we get people who really should be at the front of the queue, not having to wait in a telephone line for 2 hours to get a vaccine.
In a statement, a spokeswoman for the Federal Health Department said the vaccination of aged care workers is the shared responsibility of Commonwealth and state territory governments, and extra teams were being established in Victoria to help vaccinate workers. Data given exclusively to 7:30 by the Health Workers Union shows only a fifth of staff at aged care homes surveyed in Victoria have been fully vaccinated with 2 doses. Nearly 37% had received their first dose. A quarter reported having problems getting a vaccination.
We would really want to see 70-80% or more having had received their first dose of vaccine by now, because the biggest group that die in large numbers are the aged care facilities, and the biggest way that the virus gets into those facilities is through these workers.
Professor Collignon is among experts calling for Melbourne schools to reopen.
I think there needs to be a higher bar to closing schools, particularly primary schools. In no occasion really have schools made a lot of difference with the low levels of transmission we've had.
Primary school teacher Marie Shields' classes have returned to remote learning during Melbourne's latest outbreak. She's juggling that with teaching her own children at home.
You've got those students who are struggling and who really fell behind last year during lockdown.
She wants schools to welcome students back as soon as it's safe, but believes teachers of all ages should be a priority group for vaccinations, along with other frontline workers.
Oh, they're the ones that you've done.
I've been a little bit worried about being exposed to it at work. The school that I worked at last year, there were a number of cases within our school that did contract it during the lockdown period.
How did you work that out, Isabel?
At the age of 40, Marie is now eligible for vaccination, but she's been having trouble booking one.
I can't get through on the hotline to make an appointment, and I have tried a number of times. So making it a priority would be really helpful, and it would mean that the students wouldn't miss out on as much of that face-to-face learning time.
Professor Collignon agrees teachers should be vaccinated, however, not before high-risk groups in the 1A category.
The vaccination of 30 or 40-year-old teachers, that is a priority, but they're less of a priority than all the other groups.
In East Melbourne, Frank Matisich is worried about his 45-year-old daughter Tanya, who lives in a disability home on the New South Wales mid-north coast. Tanya, who has an intellectual disability, is in vaccine group 1A, the top priority category for those at highest risk. But neither she nor the other residents or staff have received a jab. And the Disability Trust, which runs her home, says it's been waiting for the federal rollout to reach them since February.
Well, I think it goes beyond disappointment, and I don't have much faith in whoever was organising the logistics of this exercise. I've written to Minister Hunt, I've written to the opposition, I've written to the National Disability Service, and nobody has given an answer into the reason why they have not adhered to the original schedule. All that comes forth is to say, oh, it'll be soon, it'll be soon. Well, I think now 4 months later, it's not happening.
In a statement, the Federal Health Department said they were working to vaccinate people with a disability as quickly and safely as possible. The Disability Trust told 7:30 that across their 85 homes in New South Wales and the ACT, only 3% of residents were fully vaccinated, while 26% have received the first dose. Tired of waiting for the federal vaccine rollout, they're now organising their own vaccination. Frank says if Tanya were to contract COVID, it would be a traumatic experience.
She doesn't understand what's happening to her. I mean, when she gets the flu, she's pretty upset with the flu, and this is a lot worse than the flu.
And should there be more urgency to get these top priority people vaccinated?
Well, I think the top group do all need to be vaccinated. And if we get 90% at least of that group vaccinated, they're all in a better position because they'll transmit it less to each other, but also it gives them huge protection. It'll decrease their death rate by 90% as well.
In response to the outbreak and increased demand for vaccines, the federal government this weekend announced 100,000 extra doses would be sent to Victoria to bolster the state's supply in the weeks ahead.